All right.
We'll start the video. And there'll be spots where you guys can stop and practice. Make sure you're not killing anyone.
Heart disease is the number one cause of death in the world, more than 17 million deaths per year.
Cardiovascular diseases claim more lives than all forms of cancer combined.
Early recognition and CPR are crucial for survival from cardiac arrest.
High-quality CPR saves more lives.
American Heart Association. Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves.
I would say the first time I performed CPR, I felt frightened.
Confused.
Scared?
It was surreal. I wasn't sure if it was good enough, and if the patient didn't survive, I wasn't certain, was it me?
And suddenly, he stopped talking to me. I was getting ready to take the blood pressure, and then he just stopped, like mid-sentence.
I think 3 years older than me, and he was sprawled out on the front steps of a coffee shop.
Where the medics called and they were bringing in a guy who was having an acute MI.
It sometimes can be a scary situation. Relax. The training and skills are there for a reason. You know what to do.
It's such a practice thing. Everybody's taken CPR and you've done it so many times.
It was more like in the moment and I knew what to do. So I felt confident in my skills.
There's always that moment where you've got to step over your own shadow to let the training and the fundamentals of what you know is important come through.
You never know when you're going to need to use it. And when you do, you don't want to have to stop and think about it.
Things are always changing. American Heart Association helps you stay on top of that.
The American Heart Association training is really focused on providing you with the tools that are needed for resuscitation.
So learn the rate, listen to what the instructor's saying, and do it well. And then be prepared
Listen to me.
that it's not going to be like that.
We always need to perform. We always need to do what we're called upon to do, no matter what the situation is.
We coded him. We ran the code. We did CPR. We shocked him and we got him back.
And very quickly went back into a normal rhythm.
It's the look on his face and talking to his family that I really remember.
It was a good day.
Everybody knew their role, high-quality CPR. A couple of weeks later, the gentleman walked into the firehouse and shook our hand and said thank you.
When you realize that this guy was completely, out and his heart wasn't beating and you just brought him back. That is an amazing feeling.
So we do pre-hospital because most of the time if you're going to do CPR, it'd be before the hospital.
Those are just a few stories of providers who know the importance of what you're about to learn. Basic life support, or BLS.
On any given day and at any time, you can encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. And with the training you receive today, your actions can give the victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for demonstration purposes in this course, we will perform CPR on adult male victims.
That's gonna manage.
No, that's not going to work.
John. John. Are you okay? John? John! Help! Can someone please help?
Got a person down at transoceanic under 24.
Wake up, John, wake up.
Sir, are you okay? Can you hear me?
He was just on his phone and then he fell over. I don't know what happened.
Possible cardiac arrest, medical assistance needed.
What?
1, 2, 3, 4, 5, 6, 7, 8.
I'll get the AED. I was like, man, he's coming now. What? He didn't even say so fast.
2, 3, 4, 5,
CPR on a living person that has a heartbeat.
Apply pads to the victim's bare chest.
I'll attach the AED around your compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12,
Plug in
14,
pads.
15, 16, 17, 18,
Analyzing rhythm. Do not touch victim.
Stop compressions, clear the victim.
Shock advised. Charging. Do not touch victim.
Keep clear.
Press the shock button now. Shock delivered.
Are you okay to
Resume
continue?
chest compression.
Let me know when you need me to take over compressions.
6, 7, 8, 9, 3.
Excuse me. I'll take over compressions. Check the pulse. He's got no pulse, he's not breathing. Start CPR. How long was it down?
About 2 minutes. I started CPR right away. She attached me.
started defibrillator. Did you deliver a shock?
We did deliver one and then more compressions and 2 breaths.
Analyzing rhythm. Do not touch victim.
All right, back up.
Clear the victim for analysis.
No shock advised. Resume chest compression.
Wait, he just moved. He's got an organized rhythm.
I have a pulse. He's breathing.
Let's move him.
Let's get the stretcher. You come with us, we're gonna go to the hospital.
Okay, thank you.
First, let's talk about the adult chain of survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. After that, rapid defibrillation is used. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest care.
There are slight differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest with patient monitoring and assessment by the medical emergency team or rapid response team when a patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action, with the victims seamlessly treated. So now, let's go back and review the links in the chain of survival as they happen.
It's a normal day at the airport. We see the man's wife notice that he's not looking well. After he collapses, she immediately calls for help. A security guard rushes over to help. The guard gets no response or sign of breathing, so he directs a coworker to activate the emergency response system. The chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system.
A rescuer must recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The guard immediately begins chest compressions without delay.
The second guard returns with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely. As the EMS providers arrive and take over care, they extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim. Once the return of spontaneous circulation, or ROSC, is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and on interventions that can improve long-term survival. These 5 links of the chain, immediate recognition of cardiac arrest and activation of the emergency response system, early CPR, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care, show the most important actions needed to treat cardiac arrest. Basic life support is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for victims of all ages, and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen.
You can see the guard scan the scene to assess safety in the terminal, even alerting another officer on his radio. First, he tries to get the victim to respond. Then, he checks the man for breathing by watching for chest rise and fall. He sees no sign of breathing.
Although the guard detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR.
As a lay rescuer, the guard does not check a pulse. Lay rescuers should not check a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally.
We see the guard start CPR by removing the victim's shirt and giving chest compressions. You can see that he places the heel of one hand on the center of the chest just over the lower half of the breastbone. Then, he places the heel of his other hand on top of the first, and he keeps his shoulders right over his hands for leverage, with his elbows straight.
The critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions in compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of feedback devices to ensure that your compressions are the correct depth. We'll talk about feedback devices later.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compressions. After the second guard returns with the AED and kit, she first turns on the AED. She then removes the adhesive backing and attaches the pads according to the diagram.
And the compressions are given throughout the process to keep blood flowing to the victim's heart and brain. Once the AED is powered on, it will give audible prompts on what actions to take.
Right here, the AED prompts responders to stop compressions while it analyzes the victim's heart rhythm. It takes just a moment for the AED to advise that a shock is needed. The second guard makes sure nobody is touching the victim so that the electrical current from the AED doesn't transfer to someone else. And then she delivers the shock.
Once the shock is delivered, most AEDs will give a prompt to resume compressions. But if it doesn't, compressions should resume immediately.
The guard initially provided compressions without ventilations because he did not have immediate access to a barrier device such as a pocket mask. Once the AED that included a pocket mask arrived, the guard was able to provide compressions and ventilations while the second rescuer used the AED.
The EMS team has arrived to take over. They use good team dynamics by asking the guard to summarize the history of events and care provided.
The EMS team assesses the victim and confirms that he is still in cardiac arrest, so they resume CPR. Now, ventilations are provided using a bag mask device.
The EMS team attaches their manual defibrillator to the victim. The device used by this team can be set to manual or AED mode. Use of the defibrillator in the manual mode requires advanced training to operate that we won't be covering in this course. In this scenario, the defibrillator is set to AED mode.
The AED advises that no shock is required, and the victim begins to move and breathe. The EMS team identifies an organized rhythm and a pulse.
It's worth mentioning that there are many ways that this scenario could have been different. This scenario shows how an integrated system of care helped to achieve a positive outcome, from the bystander recognizing a problem and getting help, to the lay responder initiating care, to the EMS team arriving, stabilizing, and transporting the victim to the hospital for post-cardiac arrest care.
You never know what situation you'll face or what resources will be accessible. But our goal is that with today's training, you'll have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.